Hello and welcome to ADEC's In Conversation special series addressing COVID-19. I'm your series moderator, Dr. Jill Harrington, coming to you from the greater Washington, D.C. area. And with me here today is also Mr. Isaiah Allen, Executive Director of ADEC in Minneapolis, Minnesota. Today we welcome Dr. Kathy Shear, who's coming to us right now, currently residing in Arizona. Dr. Shear is the Marion E. Kentworthy Professor of Psychiatry at Columbia University School of Social Work and Director of the Center for Complicated Grief in New York City. Today, Katherine Shear will be talking about COVID-19 and complicated grief. Thank you so much, Dr. Shear, for joining us here today, taking time out of your busy schedule.
It's a pleasure, Jill. Thanks for inviting me.
Well, we've had so many conversations this week with our other colleagues in the field, those of us working in death, dying, and bereavement. And this conversation about the potential for complicated grief amidst COVID-19 has really come up in most of these conversations. You know, there's lots of risk factors that us as thanatologists, grief counselors, and therapists are really seeing out there. For instance, you know, whether people are dying of COVID-19 or dying related to, let's face it, death is happening in the midst of COVID-19 from diseases such as cancer, stroke, accidents, illnesses, suicide, homicide. You know, and people our ability to grieve and to mourn and to be by bedside with those we love may not be able to be there, and also maybe not engage in some of those rituals that give us comfort or kind of buffer that distress of bereavement. A lot of those are being delayed. A lot of practices that we are used to either culturally or religiously, the way we bury our dead. Also, people may have excessive feelings of guilt, not being able to be there with their loved one, or self-blame. Maybe they were an unknowing COVID carrier, or you know, they feel really high amount of self-blame or guilt for not being able to be there to care for their dying loved one. So, you know, we see a lot of delayed and cumulative grief in folks, and much like we kind of potentially saw after 9/11, where people were not able to say goodbye to their loved ones. And I remember being from Long Island myself, like there was just funerals that were happening for a year or two post 9/11. And so we know now that people really aren't able to have those funerals and those rituals. I just recently heard an interview with a young widow on Long Island whose husband was an assistant principal at Mary Louis Academy, where my mother graduated in Queens, New York, and he was 42 and just died of COVID. And she was saying that she really feels like she's not really grieving because it feels like her husband has just gone off to work, because life hasn't really returned back to normal for her. She's not able to bring her kids to school or engage in her job. So these are some of the things that, you know, as practitioners, we're seeing out there. So I wanted to talk to you a little bit today about really sharing with our audience, like focusing on grief related to death. But some people would say, isn't all grief complicated? But I wanted to ask you the question, what is complicated grief? Maybe you could help us better understand that.
Sure, Jill, I'd be happy to try to help the viewers here understand how we understand complicated grief, because you're right. For one thing, grief is all complicated, and I'll say a couple of words about that in a minute. But the other thing that's complicated about complicated grief is that everyone thinks of it differently too. So that makes it a little complex. And one thing about the way that I'm going to talk about complicated grief is that it has another name, and that other name is prolonged grief disorder. And that is, viewers might be interested to know that as of today, as a matter of fact, the American Psychiatric Association, DSM-5, has posted a proposed criteria set for the diagnosis of prolonged grief disorder, which actually matches the one that has been provided already by the World Health Organization. It is in the International Classification of Diseases 11, which has been approved by member nations. So what's important about this for right now is that anyone who's interested can go on to the American Psychiatric Association website. And perhaps, Isaiah, we can make this available, the link, specific link, because it's open for public comment as of today, and they're very interested in that. And we're hoping at the Center for Complicated Grief that people will endorse this particular version of this, of the criteria. But I don't want to get into that. I want to really talk more about how grief is complicated, and also what prolonged grief disorder is, to differentiate those two. So I think the first thing to think about is that grief itself, we're talking really about the loss of someone close. And if you're going to understand what the reaction to the loss of someone close is like, and that's what grief is, the reaction to loss. That's what I think we agree about that definition. So if you want to know what happens when you lose something, you have to know what it is you have when you have that something. And in this case, we can understand what a close relationship is by learning from our colleagues who study those relationships. Psychologists who study love relationships, and in particular, attachment theory tells us that people that we're close to provide us with some very, very important functions in our lives. They make us feel safe. It's really our relationships with the people that we're closest to that help us feel safe when there's a threat like the COVID virus. And they also provide us with encouragement to go out in the world and explore new things and learn and grow, and also problem solve. And so that's called the secure base function, and the first part is called the safe haven function. And they're people that, generally speaking, we find rewarding to be with, and we don't want to be separated from them. So all of those things are very important. But what's also important is that there have been a whole series of studies, literally at this point, I think hundreds of studies, that have shown various ways that our close relationships help us regulate our sort of psychological functions, meaning our emotion regulation, our sense of self, our ways of thinking, problem solving, all kinds of things like that, as well as our physiology, actually, our cardiovascular system, our immune system, our sense of temperature regulation and pain sensitivity. And there is even some evidence that our close relationships have an effect on our sort of epigenetics and in the way that our genes function. And a lot of that goes on out of awareness. But when we lose someone close, we're losing all of that. We're losing our safe haven, we're losing our secure base, and we're losing these kind of regulatory functions, some of which we're aware of and some of which we're not. Like sleep and appetite, or sleep and eating behaviors, not so much appetite, we know that they affect those kinds of things. So grief is complex because it involves all of that. And also because it has within it thoughts and feelings and behaviors and social interactions. So that also makes it very complex or complicated. And then the last thing that I think of, two more things I think of in terms of the complications of ordinary grief, so to speak. One of them is that grief is not one thing, even for one person. So it changes over time. It changes kind of erratically, especially in the beginning when it tends to be very strong. But even then it evolves over time because it's permanent. When someone dies, their loss is permanent. And so our response to their loss is also going to be permanent. So we say that grief emerges naturally after someone we love dies, and it finds a place in our lives. And when it finds a place in our lives, it no longer interrupts us or kind of gets in the way of our life or stops us from living our life, but rather it usually later on, the loss and the grief can actually help us grow and develop as people and makes us wiser. So, and then the last piece of how grief is complicated is that we all have certain natural reactions to losing someone close. So, and that includes sort of protest, where we want to say no. When someone dies, even if we're expecting the death, that moment of death, it often evokes that feeling of like, no, I don't want this person to be gone, or it isn't fair, or it's wrong that they died, or something like that. And then it also makes us feel anxious, and we start to worry about what's going to happen now and how are we going to manage without the person. And then not infrequently, we also have the sort of caregiving side of us will experience what we call caregiver self-blame or caregiver related anger, which is where we think that we, like you were mentioning with the COVID virus, that we're going to start, I think everyone's going to think, well, I couldn't be with the person when they died and I let them down in some way. I should have figured out some way to do it, even if it's irrational, that we have those thoughts. And also that other people let this person down. I call that the mother lion syndrome, that we feel very protective of the people we love as well. And so, we tend to think, that maybe someone didn't treat them right, or in this case, there's so many opportunities, again, with what's going on with the medical system to say that maybe they didn't get the right care, that sort of thing. We also naturally and automatically generate what are called counterfactual thoughts about the event of the death. Anytime anything, even trivial things or very important things happen, our brains, it's part of our kind of sophisticated and wonderful human functioning, is that we can simulate alternative scenarios when something happens. And we do that automatically when something that we don't like happens. And so we start to think about all of the things that could have gone differently. And that's also makes grief more complicated, because we're not really focused on, on the death itself, but on all the ways that it could have maybe not happened. And we also tend to want only, we think we miss want in a sense. And this is also very natural. We think all we want is this person back. Nothing else is ever going to make us happy. And lastly, we're inclined to try to avoid reminders of the loss. And that has a role in grief. But if it gets a foothold, if any of these things get a foothold, that's what's going to lead to the, in a sense, other form of complicated grief or prolonged grief disorder.
Sort of
derailment. I wasn't going to be wordy, but yes, these are derailers, exactly. They're going to derail the process of adapting to the loss, exactly.
Because grief is a natural, as you always say, because you're one of my teachers and mentors, and I listen to a lot of what you say. And what you say is grief is a form of love. And it makes a lot of sense, because we don't necessarily grieve what we're not attached to, right?
Right.
And so, the more intense our attachment, the more intense our love, sometimes the more intense our grief maybe, right?
Well, actually, I want to correct that a little bit, Jill, because it doesn't exactly work like that. I mean, I think the system itself is complicated. Again, the attachment system is complicated, and there are many facets of it. And actually, it's not only people that we're attached to, but also things that help, that are connected with our identity. Like, so for example, job loss, a lot of us, if we lose an identity defining job, we're going to also grieve. So it's, and the way we grieve doesn't necessarily just map directly onto the way we love. So even the way we love is complicated usually, and it's, it's got different facets. So it doesn't necessarily follow that if you have intense love, you're going to have intense grief. I mean, you are probably going to have intense grief.
But would it be safe to say that close relationships, typically, the close attachments, when you have close attachments, that, the normal and natural reaction to that is grief?
Right. So, I mean, yeah, so you might say that the more important the person is in your life, the more things you're going to have to, the more difficult it's going to be to adapt to their loss, and the more sort of complicated and intense your grief is going to be. I think that's what you're saying, basically, and that's very natural.
And so adaptation to loss, obviously, we are here still today. Humankind, death has been happening since the dawn of humankind. And so there's some kind of natural and normative adaptation process that we go through to really survive loss.
Right. And I think you can think about that in a kind of fairly simple way that is very helpful in working with bereaved people. And that is what it takes to adapt to the loss is that we accept the reality of what's happened and we restore our sense of well-being. So, and again, accepting the reality means we accept its finality. If it's death, we accept its finality and the changed circumstances that it brings. And again, that's going to be very variable depending on the person who died and how they died. And then we also need to accept the fact that grief is permanent after someone dies as well. And we have to accept a changed relationship with that person, not keep wanting to have them back exactly as they were, and be able to really accept and find a way, our way, whatever that might be, of continuing our relationship with them. That's what we mean by accept the reality. And then to restore our well-being, we want to, basically we know that well-being depends on what, again, psychology researchers have called autonomy, competence, and relatedness. That's from self-determination theory. And what that really means is autonomy means that we do things that are related to our own intrinsic interests and values. So therefore they are things that have purpose and meaning in our life. We need that. And we also need to have a sense of competence, that we are able to face and meet important challenges in our life. And we need to have a sense of mattering and belonging in the world. So we need relationships with other people, other living people.
All while the bereaved are trying to adapt to a period of, separation distress, usually after somebody dies. Can you talk a little bit about that?
So the separation distress and the sort of grief response that is very, you're right, it's very all-encompassing and dominant in any person's life when they first lose someone. As we grapple with coming to understand the reality, those other feelings will just naturally, we don't have to deal with them directly. In other words, they'll naturally recede because they are related to, you have separation anxiety when you think that you're separated from someone and you can't go on without them, and or you have to go look for them, that you have to seek them and find them, which is what we feel in the beginning. But as we start to remind ourselves in a way, as we start to learn, if we understand that the person has died and they're not coming back, that feeling starts to recede. And as we start to redefine our goals and plans for our life, that feeling starts to recede. And the sadness becomes bittersweet. So this happens very naturally if the focus is on helping people accept the reality and restore their well-being.
And some of that is moving through a lot of secondary losses that come from the initial loss through death. Spouses sometimes may lose a sense of what we call secondary losses, identity, having to rebuild an identity. Some of it could be financial. Some of it could be, for a spouse with children, being an only parent now and raising children on their own. So there's a lot of secondary losses people go through this process as they naturally adapt and facilitate this, adapt to loss and learn to live with loss in their lives. So how does that get derailed? Or where does grief really become what you would say complicated grief?
Right. So all of what you're saying is exactly what I was talking about, but I was framing it slightly differently, Jill. So what we're saying is that to adapt to the loss, we do have to accept the reality of that the person's gone, and also the changed circumstances, which you're calling secondary losses. But there are many different kinds of changed circumstances, some of which, well, maybe they all are also, that might just be another wording for them. But the point is, you have to, first of all, accept that they're happening. And second of all, figure out how to problem solve them or adapt to them, but really basically manage those. And what derails that process basically are things that, like continuing to say, no, this shouldn't have happened. Any of the very natural responses that I mentioned before that are part of what makes grief so complicated is because it makes us kind of ambivalent, you could say, about moving forward. We want to hold on to the past and not move forward, but we have to, and that's natural in the beginning, but we kind of, if that gets a foothold, that's what complicates grief. So if protest or counterfactual thinking or too much anxiety or anger or guilt or miswanting in the future or doing too much avoidance, any of those things complicate the process of accepting the reality. It interferes with the process of accepting the reality and or moving forward in our own lives.
So from some of the work you've done that circumstances of death or circumstances around the death can potentially lay groundwork for a much more complicated grief process. And sort of like I was talking about before about the widow on Long Island who is saying that she feels like her husband is at work and she's at home because she's isolated at home and life kind of has it. It's easy to imagine him being at work, kind of like we see in the military with combat related death when people are on deployment. And we have a word for that called deployment delayed grief, that, the widow doesn't sometimes start grieving until the rest of the unit has come home from deployment. Even though they've buried their spouse, it really delays the grief process. So when the unit comes home, they feel like those feelings of acute grief at 9, 10, 12 months later because of those circumstances. So I bring that up only because, with complicated grief, there can be circumstances that may pose more risks for people to have more derailment in their natural facilitated grieving process.
Yeah, I mean, absolutely, Jill. There are circumstances associated with the COVID pandemic, that I think make it more difficult to set some of these natural responses aside. So, for example, you mentioned the fact that people are dying by themselves. And, that means that the bereaved person is going to probably be bothered by that. And they're going to have to make peace with that in a sense, in order to set that natural sort of feeling of caregiver self-blame. I wasn't a good caregiver. I couldn't really comfort them in the transition. And you have to be able to set that aside. You have to be able to say, well, I certainly would have been there if, you do it in your own way, but that's one you could say to yourself, I'm positive I would have been there if I possibly could have been. But maybe you decided not to go to the outside of the horrible emergency room to talk to your loved one on the cell phone, which I saw also on TV. You could do that in some places while they're essentially dying or shortly before they die. And you decided you didn't, for a variety of reasons, you didn't do that. So then you could start to rev on that. You have to be careful not to get caught up in trying to change what you can't change. And it's very natural to think this way. So, it's just, so that's what's really elevating the risk here. But I want to say one other thing, because I think this whole issue of delayed grief is another thing that we don't really know fully, but it's very possible that it makes more sense to, in some sense, delay grief. Well, certainly if it happens in this pandemic situation, I personally wouldn't sort of, if I was as a grief counselor or a grief therapist, I would not push someone to, to sort of go there, because we don't have the right supports, which is another thing that you mentioned. I mean, our friends and family can gather in this way, but it's not the same as being present. For one thing, we can't touch each other, and touch is very important, physiologically important and emotionally important for us. It's one of the important ways we comfort each other. We don't have that possibility right now, and we need other people when we're grieving. So That might be a reason, or because you have to take care of yourself right now. I mean, there's lots of things that we're all having to do very differently than we usually do. And maybe if we're caregiving, especially if we're caregiving like your friend, small children, I think makes perfect sense that whatever she's feeling. I mean, I think I saw her on TV, actually. There was someone on CNN that was exactly like this.
She's not a friend of mine, but she's a friend of my sister's friends on Long Island. So she was on, yes.
CNN, yeah. And she said she thought, she was thinking her husband, it felt like he was just staying late at work. And then she reminded herself, and she didn't say it, but presumably that was associated with a wave of grief emotions and thoughts. But then probably she set that aside again because she has her kids to take care of. She has to figure out how she's going to get food in a different way, and and just all things. She has to pay attention to those things right now. So we sometimes do set grief aside, and we can grieve later. I mean, we can do that with grief, which is kind of a blessing, right?
Right. And that's often sometimes when we have a lot of practical matters to take care of, like
Yeah.
young widows with children, sometimes grief comes in slower doses, or we set it aside because we're attending to the practical matters and we can't be overwhelmed by the emotional ones.
Exactly.
We have to be able to attend to that. So with all this that's going on, I mean, what do you potentially see as possible derailments and things that could potentially lead to complicated grief for people?
Well, I guess I feel like I just reiterated them, Jill, so I don't know if we should talk about them again. Do you have a more specific question? Because
Isaiah, go ahead.
I can maybe ask a follow-up
Okay.
question for that. Maybe framing it a little bit differently, because I think I'm wondering, as you are laying out, there are so many landmines for complicated grief that we have in the midst of the COVID crisis. Do you think that, as you're describing these kind of paradigms that contribute to complicated grief, even myself as a fairly lay person in the field am identifying right and left as we're going through, oh, there, I see how that relates, I see that relates. Do you think that we'll find that these paradigms are sufficient in this situation as we have ADEC members who are providing care and counsel for people going through this? Or is the compounding of all of these factors so sufficient that we're going to need additional kind of paradigms and research and kind of track new paths through this as a result of kind of the sheer weight of complicated grief in the midst of this? Do you think that we have paradigms that can guide us through it?
Yeah,
or do you think that we're going to have to discover some new things as we go through this?
No, I mean, yes and no. Okay, that's it. Yes and no.
And way of rephrasing my question, instead of
okay, so is that what you meant? Is this good? Okay, great. But so yes and no. So what I'm talking about when I'm talking about accepting the reality and restoring well-being, I think of that as from excuse me. I'm going to be able to speak, but I think of that as being like the 30,000 foot view. That's the big picture, and it's a framework. It's really, if you think of it as a basically scaffolding or framework for where you can put what you're observing on the ground, what we observe on the ground or in the room with any given individual person. It's going to show up in different ways. And with COVID, there's going to be some COVID related ways that it's going to show up, that the derailers will show up, and that the kind of challenges in the world that we have to deal with moving forward. I mean, a big one is going to be, what if you're the person, well, let's say you're a young family and one of the two parents of a young family dies. I mean, that changes everything, right? And especially in the environment that we're expecting to see, where the economy is not going to be robust when we finish all this. So they're going to have to deal with that. So that's COVID specific, but it still fits in that same scaffolding or framework. And the reason I say that I don't think, what I'm talking about has kind of it actually literally has a biological basis, and it also has been shown to be relevant across cultures. even though there are definitely lots of cultural differences in how we grieve and how we experience losses and how we support each other, and et cetera, et cetera. But this is a big picture framework that I think, people tell me that it's very, very helpful to have it in mind when you're listening to someone, because it helps you to guide them. So hopefully that answers your question.
It does. Thank you. That's helpful.
I mean, it sounds like, Kathy, and please correct me if I'm wrong, but out here in the field, there's always the question, is suicide bereavement different? And Jack Jordan and John McIntosh would often say the answer to that is yes, but that suicide survivors often are confronted with a different set of themes in their bereavement. Do you think that might be the same with COVID, that there are going to be like a separate set of challenges, and how those people move through those challenges, just like suicide loss, may be completely different for everybody? I mean, some survivors go through, do not have complicated grief. Some actually have post-traumatic growth after a devastating loss to suicide. And some do have complicated grief. So what I hear you saying is there may be themes that are going to be specific to COVID-19 loss that may affect people in their grief.
Yeah, I'm saying that, and I'm also saying there are themes that suicide. There are ways that suicide bereavement is not different. Just like there are some ways that are kind of more common. There's some issues that are more common for a suicide bereaved person, and that's what I'm saying. You're right. There's a parallel there, because there are some issues that are more common. But I think I would sort of encourage people to try not to think that that's the whole defining. The way the person dies, or even the larger context, isn't the whole defining sort of way to think about the death or the grief, because there are similarities as well. There's both commonalities, there's uniqueness of every single person, and then there are commonalities within that uniqueness, or across that uniqueness. There are commonalities depending on who died. Like losing a child, there are some commonalities in losing a child that are kind of specific to that loss, just like you're saying with suicide. So there are those kinds of commonalities, but then there's a sort of larger overarching commonality that also occurs. That is what I was talking about.
Getting back just real quickly to counterfactual thinking, I mean, guilt after bereavement, is pretty normative for most people. Like, I wish I would have done that. I wish I could have said goodbye. That's a very common experience in the bereaved. But do you think that things like not being able to be bedside, and there may be factors here that may intensify that guilt for people?
Yeah, it makes it harder to set it aside, because I think you're right. I mean, we all have those kinds of feelings, but I just want to mention one other kind of guilt that is, I think it's virtually universal after any death, but likely to be much stronger after COVID, and that is survivor guilt. And that's a slightly different kind of guilt. That's where we feel like, how come we get to be alive when this person isn't? And even when I say that, you can see how it relates to COVID, because COVID seems to be, yes, taking people who are a little more vulnerable, but also some people who aren't. And so it seems very random, that who dies and who lives. And that's a setup for survivor guilt. And that's an especially important kind of guilt, because not only is it difficult to accept the loss under those circumstances, which is what guilt kind of does interfere with, because it takes you away from the main issue, but it also can really interfere with your ability to experience any kind of positive emotions, or to look for satisfaction in your life. It sort of makes you feel uncomfortable doing that, or even sometimes makes you feel like it's wrong to do it. And it actually is so important for people when they're grieving to allow their emotional pain to kind of oscillate, to kind of wax and wane, and to allow themselves to have moments of certainly of relief, but also of positive emotions, and to do things that can be a little bit pleasurable on purpose. That's kind of important for any of us in navigating after a loss. And survivor guilt can really interfere with that.
Dr. Wendy Lichtenthal actually mentioned that when I was in conversation with her just a few days ago on bereavement teletherapy. She also mentioned the maybe heightened state of anxiety or trauma symptoms because if someone in your family has COVID, a lot of people are very nervous about it, about other members of their family
Right.
being exposed or contracting COVID. So the kind of trauma symptoms people may be having while they're grieving as well too. Maybe something that practitioners may be seeing with people who are coming to them for grief therapy. So with that in mind, I just wanted to know, since you kind of have the ear of the ADEC members right now, a lot of them who are grief therapists or counselors or providers of care, what would you say to them about helping to promote adaptation in the midst of COVID-related deaths and deaths that are happening in COVID?
Well, I would say that really grief therapy, this is a kind of corollary of what I've said before, but maybe there's one or two things different to say, but grief therapy is grief therapy as usual. And that what that really means is being an active listener and really being present and listening and supporting people in that way, as we know that, advice sucks when you're breathing, when you're grieving, right? I mean, people don't want advice and they don't need advice. They need to be listened to. They need to be heard. They need to have that empathic presence. And I think beyond that, I would just be on the lookout for some of these kinds of things that we've been talking about and kind of gently ask people about them. I'm a big fan of the serenity prayer because I think, you can really help people if they focus on, starting to just take a look at what can they change and what can they not change. And then maybe you can help them talk through what's in the middle there, like when they're not sure, because there are always a lot of those things having to do with what you were calling secondary loss or the changed circumstance. Some of those you can affect, some of them you can't. And so figuring that out and really being sure that you don't get caught up in one of these derailers that we talked about. I think that's, kind of gently helping people pay attention to those as you're listening. But right now it's active listening.
And as you mentioned that right now people may need to delay grief for specific reasons.
Yes, very good point. And not pushing people to try to, to say, oh, you have to, it's really important for you to go there. Maybe not right now. Yeah.
There's a lot, I always say there's about 10 inches between your head and your heart. And there's a lot of miles and space in between when you're grieving. So with that said, if people do want more information on complicated grief and also your complicated CGT therapy, where can they find that information?
So they can come to the Center for Complicated Grief, that's all you have to do is type in centerforcomplicatedgrief.org if you want, or .columbia.edu. But I will say that it's not a complicated therapy. It's actually a pretty simple therapy. So it's it's also designed for people a little bit later in the process if they do develop prolonged grief disorder. But, that's a whole other talk that we could have maybe sometime later. But for right now, I think for COVID, we really want to focus on the early grief, right?
Right.
But we do have information on our website that might be helpful.
People wanted to be proactive and kind of get trained now.
Yes.
The time may come when they need it in their practice. They can come because you do certifications and workshops and a lot of other great information.
And they're all online. We just had I think 70 people or so on a workshop that was online. So
that's fantastic.
Yeah.
Well, Dr. Shear, I want to thank you. You and I always have robust conversations. I want to thank you so much on behalf of ADEC for joining us here today to talk about COVID-19 and complicated grief. And for all those who are watching out there, I hope you're practicing safe social distancing, listening to the advice of the CDC and Dr. Anthony Fauci. Be safe and be well. And thank you, Dr. Shear, you too as well.
Thanks, Jill, and you too. And Isaiah, thank you Thanks for having me.
Take care.
You too.